Hello, my name is Rasika Godbole and I am making this video as a part of my assignment for the behavioral medicine course that I'm taking as a part of my MSc Clinical Psychology curriculum at Christianity College. My roll number is 21 MPSL 46 and now I will begin with the video. This video is about the health benefits of ballet, as you can see on the first slide. So first let's learn about what ballet is. Ballet is an ancient art form. I think a lot of us are familiar with it. It originated in the 15th century with the Italian Renaissance, and then it slowly spread to France and Russia. You can see on the slide there's a painting of a traditional ballet costume. So the defining feature of ballet is that the dancers dance in a special kind of shoe. They are called as unpoint shoes. So when the dancer reaches a certain point or a certain level of training, they are allowed to wear these shoes, which allows them to literally dance on their toes. And it's full of graceful movements, especially the pirouettes are a kind of spinning movement, which is very popular in ballet. And ballet dancers usually, if they want to have a career in ballet, which can be quite competitive, they have to follow really strict discipline with their daily schedule, and there are dietary restrictions, and it becomes a very big lifestyle adjustment. So ballet is very popular today all over the world. There are multiple methods and traditions of ballet. um, there are a few ballet acts that a lot of us must be familiar with, like Swan Lake, Nutcracker Tale, Giselle, and so on. So, coming to the health benefits of ballet, here we are going to talk about short-term ballet training for a period of say 6 to 12 months to begin with, because it is very hard to keep that kind of consistency. Which is something that professional dancers they make it happen, but it's very difficult to follow all the discipline and all the restrictions. So let's just talk about short-term training in this video. So I have whatever health benefits I'm mentioning now, they are all research based, and I have given the citations in the bracket. So there have been studies on muscular strength and balance. Muscular strength is more prominent in experienced dancers, but improved bodily balance is something that is observed even in novice populations, even in clinical populations actually. Um, there was a study done in 2001, which was the population was children between 8 to 11 years of age, and they were training in ballet for a period of at least like 12 months. And the range of motion of their hips and hip strength significantly improved after ballet training. Um, Also, there is research on ballet specifically in the older adults. They have they report experiencing a sense of mental well-being and community, because they go to the ballet class every day and they rehearse with the other dancers, and that really improves their social functioning. There is, apart from that, one study on Parkinson's disease and how people having Parkinson's disease, when they participate in ballet training, it improves their motivation and their balance and stability, which is one of the difficulties that they face actually. So ballet can actually be good for them in terms of balance and stability, their motor functioning. Also, there is one study done in 2020, and it proposed that bar exercise. So, bar exercise is a form of warm-up exercise, let's say in ballet, where in every ballet studio or in the ballet classroom, there is a bar, and we take the support of the bar with our hands as we do these exercises. And the exercises are meant to improve, flexibility and loosen up your muscles before you start your training for the day. So these bar exercises can actually, they are being proposed as a preventive medicine for knee pain, especially among young adults. So now that we have discussed the health benefits of ballet, I'm going to discuss some of the risks or some of the limitations, drawbacks involved. So traditionally, people who undergo intensive ballet training often have suffer from stress fractures in their ribs. Um, they have foot injuries because the entire weight of the body is balanced on the foot. Also, low bone mineral density in the arms is something that they experience. And finally, because they are so concerned about their dietary restrictions and their body weight, they may be very vulnerable to eating disorders. Also, traditionally, ballet has been criticized because the choreography is so complicated that it is to a certain extent ageist, as in only people up to their early 20s or late 20s, only they can follow the dance routine, and people who are older than that are not appreciated for their talent. So these are some drawbacks of ballet. But in the recent years, ballet has become more inclusive, and there are ballet trainers who are willing to work with different kinds of populations of different ages and different physical capacities. And there are different forms of therapy like art therapy, dance therapy specifically, that can include ballet. The only caution is that if you have any kind of injuries in the body or any kind of muscular problems or fractures, then you should really consult your physician before you start ballet training. But otherwise, people of all ages are encouraged to participate in ballet training these days. So as long as you're being careful, as long as you have a professional trainer, and as long as you are continuously consulting your doctor, it is very much possible to enjoy all the health benefits that ballet has to offer. And this is the slide where I mention all the references, that is all the research papers and articles that this video is based on. Thank you very much.